It's very good to be here. I traveled from Austin, Texas, and I am thrilled to be here so I can both present, but also so that I can sit out in the audience and listen and participate with you for the rest of the day. I have a quote by Thomas Edison. The first requisite for success is to develop the ability to focus and apply your mental and physical energies to a problem at hand without growing weary. And some people would say that's what we're in the business of doing when we talk about the transformation of communities that have been disinvested over a period of time. There is a short 2-minute video that I'd like to open with, so I think that's my cue to say, play the video.
A quarter of all Americans are born into a place of poverty. But what if we could change the place and change the outcome? Eastlake was the toughest neighborhood in Atlanta, but not anymore. The Eastlake Foundation is changing it from a place of poverty to a place of possibility. Thanks to Tom Cousins and the help of hundreds.
Had I been born there, I'd probably be in jail.
Working together, business, government, residents, donors, and other doers dug in to grow a neighborhood where hope grows deep. Person after person pitched in, like Eva Davis, who led the community.
They tore down hell and they built heaven. And now we are living in paradise.
To break the cycle, the Eastlake Foundation had to break the mold with housing that's open to every income. Education from cradle to college. Community wellness for everyone. It's affording opportunity to all, because we can't afford not to. Poverty is more than a lack of resources. It's a lack of possibility. Help us make more possible. More diplomas, more healthy hearts, more hope, more places to come home to. Become a donor, become a doer at eastlakefoundation.org. Together, we can make a place for possibility.
So in the voice of a child, you have heard a very quick description of the transformation of one of Atlanta's most violent, most disillusioned communities. Eva Davis was a resident leader who had lived there for several decades, and along came a man and a housing executive director who said, we want to make a difference. And Eva Davis said, no way, everybody's promised things, that's not going to work. But this triumvirate, 3 people, a professional in housing, a philanthropist, and a civic leader, came up with a model that we are now working with communities around the country. And what is the impact of that on people's lives? Well, Eastlake had a 18 times the national average crime rate. 13% of the families were headed by someone who worked, and the remaining didn't work. The children were achieving at the lowest level, 69th out of 69 schools. Fast forward 15 years, 16 years, and even almost 20 years now. It is the top performing school in the city and one of the highest performing schools in the state of Georgia. A complete transformation, because education became the centerpiece of this transformation. But it didn't start there. It started with housing transformation. Instead of concentrated poverty, we moved to mixed income housing. 50% of the rental housing is now market rate, and 50% is publicly financed. We built sidewalks. We incorporated a YMCA and physical education. by lowering the crime rate. We lowered the risk of young people being victims of violence. Over 90% of the residents when we started were the victim of a felony. Tom Cousins and others came along and said, let's start an organization that helps other communities across the country do exactly the same thing. I was involved early on prior to running for office, and after leaving office was invited to come back and work with purpose-built communities that grew out of the East Lake model. We are now working in 10 other cities. Some of them you might know about. New Orleans, Charlotte, Spartanburg, Omaha, and we are engaged with communities across the country, another 20 communities. Now, how is this related to health, and what is the intersection? So not too long ago, in 2008, the Robert Wood Johnson Foundation pulled together a commission called the Commission to Build a Healthier America, and there were 10 recommendations in 2008 and 2009. And 2013, they came back together. And out of that commission's work, a cross-section of healthcare professionals, community development professionals, and others produced the new report. And one of the 3 recommendations is that in order to promote health, because we know now that where you live, what your zip code is, actually has a direct impact on health outcomes, how long you will live, what kinds of diseases, your access to healthy food, the kinds of schools that you attend. We now know that. So the Robert Wood Johnson Foundation came out with a new report, and that report clearly states that if we build healthier neighborhoods like Eastlake, we will get better outcomes, not just in education, but also in health. I was privileged to serve on that foundation, that commission, and we are very excited that we are seeing a big difference. So one of the maps that I'm not showing today is in Minneapolis, not too far from here. And if you look at the zip code map, you will see that in a very short distance, 3 miles, there can be a difference of 13 years in terms of life expectancy. 13 years. Now, people are born into a zip code. The question for us as we move forward is, what responsibility do we, as leaders, as community participants, as voters, as people who are working in any field, what responsibility do we have to do something about this? So that brings me to being a mayor. We have every responsibility. One of my favorite quotes when I was serving as mayor was, the best way to predict the future is to create it. And what we are hoping for is that we will find the creation of new, innovative models that build on the research that you do at Mayo, the research that is going on across the country, that promotes this intersection and breaks down the barriers between the professions, so that the healthcare provider is thinking about the community development impact. One of the initiatives is the medical legal partnership that is underway and being modeled in Boston, so that medical teams are working with legal teams and people are on the legal team. So if a child has asthma and is being treated for asthma or respiratory disease, they can be treated in a medical facility and get the best treatment. But if they go back into a home or a school that is not clean and the air is not clean, we've got a problem. The same is true with health care. You're diagnosed with a serious disease. You receive treatment. Perhaps it's managed. Maybe, hopefully, it's cured. But in the process of that, you lose your job because you're an hourly worker. You can't afford, not only can't you afford the care, and if that is handled, you can't afford to lose the time at work. Somehow or another, we have to integrate these issues. So my closing point is this. How many people in here vote? This is not a partisan question. The best time to ask a political leader or a politician what they're going to do about your issue is when? Before they're elected. Right now. Before November 2014, before March, whenever your election is. That is the time to influence the public opinion that is going to influence the public opinion and the public policy. An organization like Mayo Clinic, like those who are represented here, if you want to change public policy, do not wait until after the election. The second way to do it is to find another public official to be an advocate. It is fine to have advocacies within our fields, but it's even better to find advocacy outside of our field, a third party. And that third party needs to be a public official at some time in their career. And then the third thing that you can do to influence public policy is to run yourself. A lot of people say, well, I couldn't do that. Well, if you can't do it, why should I? Or why should your neighbor? So my advice is get to the public officials early and specifically about what you care about. Number two, to find a public official that supports your point of view. And three, run yourself. So all of you who voted, how many will run? You get my point. The democracy doesn't work unless you run. The best way to create the future and to predict it is to create it. Thank you very much.
Here, Mary, we're going to get you some water with a few questions.
Oh, thank you.
Yeah, there we go.
That's an age.
I know the feeling out here.
I know. It's early and it's age.
Yeah, great. You know, we talked a lot at the very beginning of this conference about whose responsibility is healthcare. And, you know, the theme of elections in the United States really since the 1980s has been running against government. And I'm wondering how that complicates your ability to say, hey, government can take some responsibility in healthcare and community development without running straight into the argument that, well, government is the problem, that sort of thing.
Well, we can talk about that in a big picture, or I can talk to you, John, about something. The city of Atlanta is not responsible for human services or health care. Our county government is. However, I was invited by a local hospital to come to a program about the loss of life associated with not getting a CPR treatment to people who suffered a heart attack. And as is typical, I was given a set of note cards by my staff. And I was full of praise for the doctors in the hospital. But as I heard the doctors speak before me, it became clear that I wasn't doing enough as a city official. So after that, working with CDC and the hospital, we designed a program so that every city employee, when they were hired, was actually trained in CPR. They got on-the-job training, paid training, 8,000 employees. And in addition to that, we continued that with the new hires, and that continues today. Now, that doesn't seem like a big thing, but it was a really big thing because it set off a discussion both among the employees and their families about the value of being trained and what significant difference that could make. I actually got letters from employees. In those days, there was no email. I got letters from employees thanking me for helping make them better citizens in their neighborhoods and in their communities. We did similar training in the 1980s when Andrew Young was mayor around the issue of HIV. So local officials who don't have these healthcare responsibilities formally by charter have the opportunity to influence that. I spoke with someone earlier today backstage about nutrition. You can influence the kind of nutritional meals that are provided on the work site. Somehow or another, we have to embrace this as part of national security, productivity, performance, just as we attempt to do that with school children.
How open are adults to these kinds of interventions? School is sort of a blank slate. You can go in there, you can do the lunches, you can certainly intervene in terms of health care, vaccinations, that kind of thing. The work site is a different sort of place. How open are people on the work site to these kinds of things?
We found that employees in Atlanta were very open. We started a program with a nurse on site in City Hall that was available to the employees. They loved it. They did, for minor problems, they could see the nurse as opposed to taking time off from work and traveling some distance. As you know, there's long distances to travel in Atlanta. We built a walking track in City Hall. We built a gym in City Hall. I mean, mayors across the country are doing this sort of thing. One of my favorite stories is a mayor who does a monthly walk with citizens. And she is in Michigan, Brenda Lawrence. And once a month, city residents can join her for a 2-mile walk in one of the city parks, and they can talk to her about anything they care about. So they both get exercise and they get the ear of the mayor at the same time. So I have not found great resistance. I mean, if you read the media and you just pay attention to the gripes, but I mean, no one would ever be mayor if all you did was pay attention to the gripes.
Exactly. Is the Robert Wood Johnson Foundation report that you referred to publicly available?
Yes, it is. It's available online, and it's been out for about a year, and it's getting picked up and discussed. It includes early childhood education investment, and also breaking down the barriers between the healthcare fields and the community development fields.
That's great. There are a lot of people who have questions about this zip code to zip code disparity between life expectancy. How destabilizing do you think that is within cities? And you referred to a national security question nationally. How destabilizing is that nationally for our country?
Well, it is destabilizing because, in my opinion, America needs every single person to be as productive as we can be in order to have the kind of prosperity that we've come to expect. So if we have people who are suffering by virtue of location, and we know that, we have interventions that we can use, and we need to deploy the investments in order to do that. I'm a strong advocate for that. Now, I'm not a small government advocate. I'm a effective government advocate. So I want to do what it takes to be effective, to reach the overall goals, which is the health and wellness of cities, the health and wellness of states, and therefore the health and wellness of the United States.
Unfair question.
They're all unfair when you're mayor.
Is Hillary going to run?
Oh, I have no idea, but I hope there's a robust debate about health care and community development and poverty in the next election.
Mayor, thanks so much.
Thank you.